Hi, my name is Lauren. I'm going to be your student nurse practitioner. We're just going to go and do a full head to toe assessment and document any findings. If at any point there's any tenderness upon touching or palpation, just let me know, okay? At first glance, let me see, your skin looks intact. There's no lesions, no different shaped moles present. Very good. You have no facial deformities. You appear your age. I'm going to go ahead and put some gloves on. And I'm going to look at your head and facial face first, okay? Let's see. Okay, upon palpation, there's no bumps in your head, normal cephalic, scalp, no dryness, no irritation, hair is evenly distributed. Let me see. Eyebrows are symmetrical, eyes are symmetrical. Smile for me. Smile is symmetrical. Let me see here. Let me just look in your eyes. Look up for me. Conjunctiva is pink, no redness, no drainage noted. Your skin is intact, no lesions. Let me look at your hands. Cap refill is great. Okay, now hold your hands like this. Okay, no clubbing noted at this time. Excellent. Now I'm going to do some cranial nerves, okay? Now, this is going to test your periphery, so when you see my fingers, these blue things coming, just let me know when you see them, okay? This is cranial nerve 2.
I see them.
Okay, can you see them above?
Yes.
And below?
Yes.
Okay, perfect. Now I'm going to look at cranial nerve 3, okay? Can you look up for me? Great. Cranial nerve 4 down. Perfect. Now side to side. Cranial nerve 6 is all intact. Okay, smile for me. Frown and puff up your cheeks. Perfect. Cranial nerve 8 is intact. Now I'm going to use my pen light and I'm going to look at your pupils. Make sure that they're equal and reactive, okay? So just look straight at me. Don't look at the light. Perfect. Pupils are reactive and consensual, 3 mm for measurement. And look at me. And when I did your other cranial nerves, there's no nystagmus noted. Okay. Let me know, is this tender at all?
No.
And your tragus, is that tender at all?
No.
Okay, and I'm going to test a little bit of your hearing, okay? Cranial nerve 8. Tell me if you can hear me, okay?
Okay. Volleyball.
Yes. Now, over here.
Banana.
Very good. Okay, perfect. Now I'm going to look at your nose. Symmetrical, no deviation noted of the septum. Now put one finger on one nostril and breathe in. Okay, now do the other nostril. Patent airways and no obstruction noted. Okay, now I want you to stick your tongue out for me. Very good. No deviation with that. Puff your cheeks and touch your tongue to each side of your cheek. Perfect. Cranial nerve 12 is intact. Let me look. I'm going to look in your mouth and also test cranial nerve 9. And we're going to skip 10, the gag, because I don't want you to choke. Okay, open your mouth for me. Buccal membranes are intact, no lesions, no bumps noted. Stick your tongue out. Say ah. Oh, perfect. Uvula does go up. Very good. Now I'm also going to test cranial nerve 5. Okay, close your eyes and tell me where you feel this cotton ball.
Middle of my forehead.
In here.
My chin. My left cheek. And my right cheek.
Very good. Okay, so now I'm going to look at your lymph nodes, okay? This is your, tell me if there's any tenderness. Pre-auricular,
No.
post-auricular,
No.
cervical,
No.
okay. Jugulogastric,
No.
submandibular,
No.
submental,
No.
supraclavicular,
No.
posterior cervical.
No.
Turn your head to your left, deep cervical,
No.
deep cervical to your right.
No.
Okay, excellent. I'm just gonna fill your carotid. Great, now I'm gonna move on to your lungs and heart, okay? Let me know if there's any tenderness upon touching.
No.
No, none. And posteriorly?
No.
No. Okay. Okay, great. I'm gonna take my gloves off here. Okay, now I'm gonna listen to your lungs on the posterior side from the apex to the bases. And just take a deep breath in whenever I press my stethoscope to your back, okay?
Mm-hmm.
Okay, great. Lung sounds are clear to auscultation, and I'm gonna look at the anterior side. Great. Everything sounds great, and there's no shortness of breath. Your chest expands symmetrically. Okay, so now I'm going to listen to your heart sounds, okay? First, I'm going to listen to your carotid. Okay, perfect. No brewery heard, no thrill seen. I'm going to listen to your heart now. S1 and S2 heard, no murmurs present. I'm going to check your pulses. Stretch your arms out for me. Okay. Radial pulses 2+, brachial, excellent. Dorsalis, pedis, and 2+. Now posterior tibial. Great. Now your popliteal. Okay. Excellent. Okay, now I'm going to inspect your abdomen. If you could please lay down. Okay. I'm just going to lift up your shirt, okay?
Mm-hmm.
Upon observation, the stomach is flat and non-distended. I'm going to listen to your bowel sounds first, and then we'll do palpitation. Okay, bowel sounds present in all 4 quadrants, and the aortic, iliac, and renal arteries were listened for as well, and no abnormalities noted. And now I'm going to do light palpitation. Let me know if there's any tenderness, okay? No tenderness? Okay, I'm going to do a deeper palpitation. Never had mono.
No.
Okay, your spleen is good. Non-detectable, perfect. Now I'm gonna feel for your liver, okay? Take a deep breath in. Okay, edges noted. Soft. Okay, perfect. And now I'm gonna feel for your kidneys, okay? It's kind of deep, so just bear with me. Very good. Let me come here. Okay, excellent. You can come sit up here in your chair again. And now I'm gonna kind of test your joint strength, okay?
Okay.
So upon assessment, all your joints, there's no swelling, they're symmetrical. Doesn't look like any arthritis is present. Okay, so I want you to look down, flexion and then extension of your neck, go back. Now look side to side for me. Okay, great. Now press forwards on my hand and resist me. So press your forehead into my hand. Okay, now press backwards. Now side to side. And this side. Great. Strength is equal and great throughout your whole neck. Okay, so now I want you to stretch your arms out ahead of you. Push down on my hands. Push up to the sky. Excellent. Now go like this with your arms and resist me. Yeah, pull in towards your body. Push out. Okay, great strength. Now we're going to look at adduction and abduction of your arms, okay? So bring your arm out away from your body. And now bring them close for adduction. Excellent. No issues with that. Can we go ahead and go around with the shoulder and look at the shoulder joint? Okay, go again. Excellent. Let's try this one. Very good. No problems with that. Can you do a rotation with your wrists, looking at the movement of the wrists? No problems with that. Perfect. Now put your arms like this and spread your fingers. Now resist me. I'm going to try to push them in. Okay. Now pull them in close. I'm going to try to pull them apart. Okay, very good. Now we'll test some of your leg strength, okay? So push the lower part of your leg out towards me. I'm going to check your strength. Very good. Now pull back and pull out, push out, and pull back. Excellent. Lift your legs up for me. And this leg. Perfect. Now that was great leg strength. Now use your feet to push on my hands like gas pedals. Perfect. And pull back towards you. Excellent. Great strength in your ankles there too. Okay, I'm going to have you stand up and we're going to check your hip. So I just want you to kick your left leg out towards the wall and then bring it in towards your body. Perfect. And now do the same with your right leg. Great. No problems with that. Now can you go forwards and backwards with both legs? Great. Okay, perfect. Now I'm going to have you close your eyes and stand with your feet close together and just stand still for me, okay? I'm going to stand for about 20 seconds. Okay, that was 20 seconds. Okay, excellent. I'm going to have you just take a couple steps towards me. I'm going to look at your gait. Excellent. Now I'm going to come back towards me again. Perfect. Now turn around, face the camera. Bend over and touch your toes, and I'm going to look for scoliosis. Perfect. No scoliosis present. You can stand back up for me. Very good. Now I'm going to have you sit back down, and we're going to test a little bit of sensation, okay? Just tell me if it's sharp or dull.
Okay.
Okay, close your eyes, and where, okay?
Okay. Sharp left arm. Soft right upper arm. Sharp right leg.
Okay.
Sharp left foot.
Okay. Very good. And now I'm going to have you repeat 3 words, okay? I'm going to have you repeat volleyball, apple, and hospital.
Okay. Volleyball, apple, hospital.
Okay, very good. And I know that you say you don't wear glasses. Your vision's 20/20. There is nothing I found on this assessment that is abnormal. You said you have no allergies, and like I said, the sclera of your eyes look nice and white. There's no jaundice present, and everything looks great. So thank you so much for allowing me to do this head-to-toe assessment. I hope you have a great day.
Thank you.
I'm gonna wash my hands.